So, class, we are going to look at the way of how we can diagnose diabetes mellitus. Diagnosis of diabetes mellitus. So, diagnosis number one, we can do what we call the random blood sugar. This random blood sugar, we have to know the normal range. The normal range usually it is 3.9 to 5.5. This is the normal range. But I went to Uganda. Most of the government facilities, they use a machine. It is called one type select. So that machine they use, the normal range there is 3.9 to 9.9. So this is the normal range. So most of the government facilities, they use this machine. This is millimoles per liter. This is what they use. This one is equivalent to 70 to, when we multiply this by 18, this is around 178.2. So this is 170, approximately 179. 179. These are milligrams per deciliter. So you can either sit in this in milligrams per deciliter, which is 70 to 179 milligrams per deciliter, or 3.9 to 9.9 millimoles per liter. It is the same. The difference is the units we use. Here we use the millimoles per liter. Here we have used the milligrams per deciliter. These ones. These machines, they are the first machines, I think, the ones who has this 3.9 to 5.9. This is 70. This one is this one when you multiply by 18, this is 1.5. So this is millimoles per liter. This is milligrams per deciliter. So this is the normal range. But currently, because these days I stayed much in Uganda, so we are having a lot of this. These are the machines now available. It gives us a range from 3.9 to 9.9 millimoles per liter. So we also have, this test, the random blood sugar, we do it random as the word sounds, randomly. Actually, when we receive the patient at the facility, there is no more organizations, but we just take the patient direct there to the lab and take off the sample there, and then we do that blood sugar. Then another one is what we call the fasting blood sugar. This fasting blood sugar, this one is planned, because after saying that your blood sugar is beyond the normal range, it's not within the normal range, we now tell you that now what you do, you will fast. Then you will take off your sample when you have fasted. That is, you can stop eating like at 10 p.m. Then early in the morning, you come to the lab for the test, such that we see whether the blood sugar, which was abnormally high, is still high or it has lowered. So once you have diabetes mellitus, your blood sugar levels will never normalize. However much you fast, it will not normalize. So there we shall see that the blood sugar will be still beyond the normal range as we have seen above. So if we see that like now, for example, if we see here the normal range is 9.9. Now if we see that it is not 9.9, it is between 10 to 11.9. Here it will be between 5 point. If we use this machine, which is not this one, we use 5 point. It will be 5.6 to 6.9. So this one we call it pre-diabetes. Here we call it pre-diabetes because it has gone beyond 9.9. It is now 10 to 11.9. So if you reach it like 12, which is greater, it's greater or equal to 12.0 millimoles per liter. Here in this one is directed diabetes. Here it indicates you are developing diabetes, but here it indicates you have developed diabetes. Here you are called diabetic, here you are called pre-diabetic. So that's the difference. So that's the fasting blood sugar. We can also do what we call the GTT. We can also do the GTT. This is glucose tolerance test. We want to see, does your body tolerate to glucose? Can it tolerate it very well? Because how do we do it? This is glucose tolerance test. In the food, it is GTT, glucose tolerance test. Now, we want to know whether the body can manage glucose very well. So here, you do the same thing, you fast. You do the fasting of not less than 8 hours. That is, as we saw for the fasting blood sugar. So after fasting, you can fast overnight. Then in the morning you come to the hospital. When you reach the hospital, we take off the fasting blood sugar and we record it. Fasting blood sugar, take off and we record it. So after taking off the fasting blood sugar, we record it. Then we load you immediately after testing you. We now load you with about 75 grams of sugar. We can mix it in water to make a good liquid. Now, after you take that liquid, like the water containing these 75 grams of water, then after 2 hours, we take off the sample and record it. We take off the sample. We test. Sample testing, we do sample testing after the 2 hours and record it. If your body is tolerating very well, is managing blood sugar very well, you will see that the blood sugar will be lowering, will be close to normal, will either be normal or very close to normal. Because the highest normal is 9.9. Now, it will be either equal to it will be either equal to 9.9 or slightly above 9.9 millimoles per liter. It will be exactly 9.9, around 9.9 or slightly above. It will be around this figure, not far from this figure. If your body is tolerating glucose very well, then you after again another 2 hours, you take off the sample. Some take off after the 2 hours, some do it after every 60. New books have now developed various methods, and it will depend on the way you are monitoring and the instructions of the physician or the instructor, what you wanted to look for. Depends. It will require you to do as directed by the physician. So that's the glucose tolerance test. We want to see whether your body is tolerating the glucose very well. Then another test we can do to test your blood sugar is none other than is called, this is the third method, this is the fourth method. The fourth method, it will be testing for hemoglobin A1C. This hemoglobin A1C. This one measures the average blood glucose that has been in your blood for the past 2 to 3 months. It's for a longer period of time. It can tell you what has been happening to you in that period of 2 to 3 months. So after telling us the blood glucose that has been in our blood system for the past 2 to 3 months, we now know what to do for that patient. They say it is the best and the standard, the test we must use. So here, you can call this one glycated hemoglobin. This test you can also call it glycated hemoglobin. Why? This is, here we are testing the amount of glucose, that has joined together or that has attached itself to hemoglobin. So that's why we say glycated hemoglobin. The hemoglobin that have been glycated or that have been adhered to by the glucose. So glucose is in the saturation. This hemoglobin, this is just a protein. This is a protein. The oxygen carrying protein, which is found in the red blood cells. So the red blood cells is in the bloodstream, and even the glucose is in the bloodstream. So the glucose will be attached to the hemoglobin. So the more hemoglobin that it has, the more the glycated hemoglobin, the more glucose that has attached to the hemoglobin is the more the glucose in the blood saturation. So every glucose in the blood saturation it has attached itself to hemoglobin. So the more it is attached there, the more it tells us how much we have the glucose in the body. So that is it. These are the tests we have to take for testing glucose. What's the normal range for this hemoglobin A1C or the glycated hemoglobin test? The normal range here, let's write here, Here the normal range, let us say, I don't know whether this one is enough. We have 3 types because we have the normal range. The normal range is this one. The normal range. So the normal range here, it must be less than 5.7%. Here, with glycated hemoglobin or A1C test, here we calculate in terms of percentage. So, if it goes beyond 7, actually it must less than 5.7, which means it should be start with 5.6, then below. Then once it reaches, if it reaches 5, if it is greater or equal 5.7 to 6.4%, this is the pre-diabetes. As we said earlier with here, the 10 to 11.9. Here in percentage, when we are carrying out the A1C, this is pre-diabetes. This is pre-diabetes. We started from down because blood sugar rises just or lowers. So if it rises, if it is here, it is normal. So if it rises to 5.7 to 6.4, that is pre-diabetes. So once it exceeds here, and it reaches 6, this is greater or equal, if it is greater or equal to 6.5%, that is onwards. That is full diabetes mellitus. So that is a full diabetes mellitus. Once it exceeds, it shoots 6.5 onwards. So that is how we test for diabetes mellitus. So next thing we are going to look at treatment for diabetes mellitus.